and today I'm talking to you about 7 common horrible habits that can cause kidney failure. Number 5 is hard to quit. Most people don't think twice about popping a pain pill or grabbing a protein bar on the go. But the truth of the matter is that many of these everyday choices can actually be causing harm to your kidneys. It's true. Over 35 million Americans have kidney disease, and if you do have chronic kidney disease or CKD and it's left untreated or unmanaged, it could lead to you being on dialysis or needing a transplant. So of course, most people want to prevent kidney disease or at least to reverse it, right? Well, here's the issue. There are so many common everyday habits that can actually cause kidney failure. And even if you think that these habits are healthy, sometimes they can actually be harmful. That's frightening, right? Well, don't be scared because I'm here to help. Your kidneys are so important. You are born with 2 kidneys and they're located in your lower back, your flank, where the love handles are, and your kidneys are responsible for filtering your blood. They filter your blood to get rid of excess toxins, excess fluid. Your kidneys are also responsible for helping to keep you from being anemic. They help to keep you with having good bone health. They help you to have proper vitamin D. Your kidneys also help to regulate your blood pressure. So yes, they're very important. In knowing this, most people try to protect their kidneys. Even you. I'm sure that you have lots of habits that you think are healthy for your kidneys, but the truth of the matter is that many people have common habits that they think are healthy, and these habits can actually be causing kidney failure. How do I know? Because I'm a board certified kidney doctor and I see patients every day who have habits that have caused them to see me. It sent them to my office with kidney disease and they really thought that those habits were healthy. So today I'm going to share some of those habits with you. So please go ahead, hit the like button because we're about to get into some of these common horrible habits that can actually be worsening your kidney health. Number 1, abusing over-the-counter pain medications, specifically NSAIDs. So what are NSAIDs? Non-steroidal anti-inflammatory drugs like ibuprofen, Advil, Motrin, naproxen. The thing is, taking these drugs definitely is a very common habit because they're very effective for inflammation and for pain. And so it's nothing for someone to take a little Advil for a headache or some naproxen for cramps or for arthritis. And truth of the matter is that if you actually have healthy kidneys, then it is okay to occasionally take some of these pain meds. The problem is if you take too many of them, okay? If you're taking above the recommended dose and if you're taking them over long periods of time very frequently. Also, if you already have kidney disease, CKD, or if your kidneys are susceptible to kidney failure, like if you're really dehydrated, if you have hypertension, if you have diabetes, if you have other things that put you at risk for kidney disease, and you're taking a lot of these pain medications, these NSAIDs, then it can definitely put you at risk for kidney failure. Here's why. The non-steroidal anti-inflammatory drugs actually constrict your blood vessels that supply your kidneys, okay? They cause a decrease in the blood flow and the oxygen to the kidneys, and this can lead to kidney failure over time. So here's what you can do instead. Number 1, even if you have healthy kidneys, make sure you consult with your doctor and make sure that you follow the directions and that you take the NSAIDs in the recommended dose. If you already have kidney disease or if you are susceptible to kidney disease, then try an alternative to the NSAIDs. Try taking acetaminophen, which is the generic Tylenol. Consult with your doctor. Also, make sure that you have adequate hydration, that you drink enough water, because being dehydrated and taking these pain medicines, okay, these excessive amounts of NSAIDs can definitely lead to kidney disease. The other thing that you can try is some alternatives to taking medicine in order to manage your pain. Consult with your doctor about physical therapy, stretches, acupuncture even, cold or hot compresses. Bottom line, if you find that you're someone who takes medications every day for headaches, every day for arthritis, then you want to make sure that you're not abusing these over-the-counter pain medications because, again, this is one habit that can lead to kidney failure. I will say that I actually have had to put people on dialysis just for using too many NSAIDs. It's called NSAID nephropathy. And typically it's someone who has bad arthritis and they're taking like ibuprofen over the counter every day or naproxen every day, or someone who's got rheumatoid arthritis or migraine headaches. And so if you're someone who is in chronic pain and you're listening to me and you know that you're taking a whole lot of these over-the-counter pain meds, please be sure to consult with your doctor and ask about your kidney function. Number 2, extreme dehydration or extreme overhydration. That's right. Too much or too little of anything just really is not a good thing. So let's start with the dehydration. It's a little known fact that being dehydrated can actually cause kidney failure. And is being dehydrated a common habit? Yes. A lot of people go all day without drinking water. Or if you're traveling, if you're on a road trip, you don't drink a lot of water because you don't want to have to keep stopping. And so being dehydrated actually is a common habit that can cause kidney failure. Here's what happens. If you don't drink enough water, then you don't have enough perfusion, oxygen, blood flow to your kidneys, and your kidneys become dehydrated. When the kidneys become dehydrated, then they begin to work poorly. This is called pre-renal azotemia. And I've actually had to put people on dialysis due to extreme dehydration. I'll give you an example. It's happened over and over again, but a lot of times nursing home patients. If you're a patient in a nursing home, and let's just say you have some memory loss or dementia, well, you might not remember that you're thirsty. And unless you have someone who's watching over you, making sure that you're drinking a lot of water, then over time, days, weeks, months, you can get extreme dehydration. And I've had nursing home patients come in and they were so dehydrated that even giving them IV fluids was not enough. I've had to dialyze them. And guess what? I've had healthy young patients, yes, athletes who've been out and about in the sun, wearing lots of equipment like football equipment, and they've gotten severely dehydrated to the point where they have needed dialysis as well. Extreme dehydration can cause kidney failure. Now, on the flip side, overhydration or drinking too much water can cause problems as well. When you overhydrate, when you drink excessive amounts of water and you're drinking more water than your kidneys can get rid of, then this can cause your blood to be very dilute and it can lead to the salt concentration being low, hyponatremia. Why is this a problem? Well, for one thing, this overhydration and this hyponatremia can lead to a swelling in your brain or cerebral edema. That can lead to seizures and it can even lead to someone passing away. You may actually remember, and sadly, this has happened more than once, but specifically, there was once a radio competition where it was who can drink the most water the fastest. And you had these people who were chugging all kinds of water, gallons of water as quickly as they could. And the female contestant who won actually ended up drinking so much water that the salt level in her blood dropped. She had hyponatremia and she got water on the brain or cerebral edema and she ended up passing away. So remember, extreme dehydration and extreme overhydration can both cause problems. Now, what can you do? For one, consult with your doctor and find out how much water is safe for you to drink. For most adults, anywhere from 2 to 3 liters tends to be a good number. So if you think about those 16-ounce water bottles, drinking anywhere from 4 to 6 of those in a day is healthy for most people. Now, if you're someone with lung disease or heart disease, you may be on a fluid restriction. Consult with your doctor. Other than just drinking straight up water, there are other ways you can hydrate. You can eat foods that are very hydrating, like watermelon, cucumbers, celery, oranges, things of that nature. As far as overhydrating, make sure that you don't go over 2 or 3 liters without consulting with your doctor. The other thing you can do is let your urine be your guide. If your urine is really dark or amber or just like a really dark yellow, then chances are you're dehydrated. You want your urine to be a really pale yellow, almost clear. And if it is, then that's a good guide that you're probably doing well as far as drinking your water. Question: what is one small change you plan to make this week to better support your kidneys? Type it in the comments below. Number 3, ignoring or not managing your high blood pressure. And let me tell you right now, this is a very common bad habit that leads to kidney failure because high blood pressure is the number 2 cause of people being on dialysis. Yes, when I take care of my dialysis patients, the number 2 most common cause is from having blood pressure that's not managed. Now, here's the deal. When you have high blood pressure, it causes your vessels to constrict, right? It causes them to tighten. And over time, this leads to a poor blood flow or poor circulation for the kidneys, okay? And so you can get something called hypertensive nephrosclerosis, or basically kidney failure due to high blood pressure. Something that happens very commonly in my office is that people will come to me. They'll have blood pressure that is sky high, but then they'll tell me, hey, I don't have any symptoms. This blood pressure is fine for me. High blood pressure runs in my family. And so it's their habit to ignore their high blood pressure. Bad habit. Because yes, even though high blood pressure does run in some families, you know what else runs in families? Salt shakers and frying pans. There are things that you can do. Number 1, consult with your doctor. Make sure you don't skip your doctor's visits and work with your doctor to manage your blood pressure. Also, I recommend that you monitor your blood pressure at home. A lot of times when you're rushing and hustling and bustling, you might have white coat hypertension or have a falsely elevated blood pressure in the doctor's office. But if you manage your blood pressure at home, okay, if you monitor it at home, then you'll have a better idea of what your true blood pressure is. Make sure you click the link in my description or visit drfrida.com to find out some of my favorite blood pressure cuffs. Also, you want to make sure that you limit the salt or the sodium in your diet. According to the American Heart Association, most adults should have no more than 1.5 grams of sodium in a day. You should also exercise regularly in order to lower your blood pressure. Be sure to watch my video on the top 10 exercises to lower your blood pressure naturally after you finish watching this video. And click the link in my bio to check out my book, Under Pressure, A Guide to Controlling High Blood Pressure. Bottom line, ignoring or not managing your high blood pressure is a horrible habit that can lead to kidney failure.